really wanted to go to med school, and now I actually get to teach docs how to do their jobs. Yeah, at first the challenges were actually getting the lab off the ground and getting clients. Then once we had clients, the challenges were making sure we had appropriate staff. And then once we had appropriate staff and we started growing, challenges were space and having enough building to work in. And so at every phase that we've gone through, the challenges were new, and we had to address them at the time. We are. Typically in a primary care setting, the doctors have anywhere from 40 to 60 events a year. And that means a heart attack, a stroke, a death, a bypass, or a stent. And after about 22 months, our docs are reporting 1 on the average. What happens is that we give the results back to the physician. Physician gives the copy to their patient. They say, call this number, schedule time with your health coach. Health coach actually sits in the regions wherever the patients are, face-to-face, telephone, chat rooms on the computer. However the patients want it, they actually interact with the patients, and they say, here's what your doc said to do. This is how to do it. This is why to do it. And these are some other things that will benefit you. Low carb diet, low fat diet, more exercise. Here's how to read a food label. This is what a food label means. Here's your shopping list. Here's a better and a best shopping list. Here's your recipes. Here's your favorite recipes. We swap out. Here's what to do to make this a better or more healthy recipe. And they'll swap out ingredients to actually help everyone on an individualized basis do what they need to do. Very little. If anyone doesn't understand how much this actually saves in the healthcare system by the cost of the events, the heart attacks, the strokes, the hospitalizations, the bypasses, the stents, they're quite expensive. And so the lab tests are less than 3% of all healthcare expenditures. But if anyone doesn't really understand that, then they'll push back and say, it's too costly for the healthcare system. With the information that you derive from it, for every $1 spent on lab testing, you can save 9 in the events. And so if they don't understand the system, then they'll push back in that regard. But those are usually kind of docs that don't get the big picture of what it all saves them.